Hello everybody, it's Patrick, and once again it's after work. It's December 19th at about 6 o'clock in the PM, and I haven't recorded any videos for a while because I haven't been working. I left the employer that I was at previously, and I've got a new job that pays better and has better hours and doing more interesting work, so hooray for that. I got a position as an admissions RN at a large, nationwide company that does hospice care. So I've transitioned from working at a small private not-for-profit, which didn't really have much in the way of management or logistic support or things like that, to a much more structured environment where a lot more resources are available. And initially I liked the culture at a small private not-for-profit, but I found there's a lot of advantages already to working for a large for-profit enterprise. For one thing, this is the first time I've had an actual orientation. In 5 years of nursing, I've never had a proper orientation, so pretty happy about that. I'm towards the end of my second week of orientation right now, and then I've got more shadowing admission nurses, RNs, chaplains, home health aides, social workers. I've got about another week of that, and then another half week or so after that, and then I'll be off on my own doing admissions. And this is exactly what I want to be doing with my career right now. I really wanted to be doing admissions rather than the primary care nurse role, because I'd done that for about 3 years or so, and it was time to do something else. And so far it looks like I'll either be doing 2 admissions a day, or I'll be doing 1 admission and a couple of the regular skilled nursing visits covering in for the primary care nurses. And already it looks like I'm going to be doing a lot more admissions in the hospital and in nursing homes and in assisted living facilities, and in addition to home admissions. And one big difference is that everything is on paper. The last place was electronic charting. But as some of you may know, that electronic charting scheme did not work out so very well. And I was actually glad to get back to pen and paper, even though my handwriting is atrocious and my hand cramps up pretty easily. I'm actually happy about moving back to pen and paper because of how horribly the electronic medical records were implemented. But we're all going to have electronic medical records come next year. I think that's the deadline that the government set for sometime in 2014 for us all to have electronic records. So when this agency transitions to electronic records, I will be ready because I have used them before. And with any luck, because this is a large national organization, maybe we'll have our own products developed in-house. That would be exciting. The EMR that I've used in the past, Suncoast, was created by doctors and did not quite have nursing in mind when it was created. But everybody's been really nice so far. I've got a lot of great feedback on my admission reports and on my patient care, and everybody just seems a lot more motivated, a lot more organized. So I'm really excited about this new team that I'm working with. I had to sign a social media policy, so to fulfill my part of that policy, I just have to state that the opinions that I express in YouTube or on Facebook or on Blogger or any of those other services, Twitter, do not necessarily reflect the attitudes or opinions of Vitas Innovative Healthcare, who I'm working for now as an admissions RN. But yeah, very excited about it. A little bit more driving because I have a wider coverage area, but that's kind of neat. And office is a little bit farther away, but I get to start later, which is nice. Hardly anybody starts earlier than 9 or 10 o'clock in the morning. So I really enjoy what I've seen so far. I'm getting to see some facilities I've never been to before because they're outside of my local area. I've been going up to the state capitol a little bit more, a little bit longer driving times, and but it still looks like I'm going to be able to actually get my work done on time, which is huge. Because of the great support, there's so many things that I have access to now that I didn't working at a small outfit. For example, there's, in addition to always having a nurse on call, there's always a chaplain, a social worker, and a doctor on call, which which is great. This agency hires its own full-time physicians. In addition to a full-time medical director, there's a physician for each of the 3 coverage areas, the 3 teams, and there's a pediatrician on staff, which is great. Haven't seen that many pediatric patients, but still it's nice to know that kind of support is there. And just everything has been going great so far. Everybody's really organized and motivated. And I was just coming from the office, and there's an office door decorating contest for Christmas, which is pretty cool. And it's interesting to see how, one environment things are done a little bit differently than in another environment. And, some of the things that I'm really excited about is more careful oversight and auditing, which I didn't think really got done in a small not-for-profit, and more clinical support. I just got my first paycheck at my new job today, which is great. Direct deposit doesn't kick into the next paycheck, so I'm gonna have to actually cash this one, which is just in time because it's almost Christmas time. I think that's pretty much it with that. I'm going to be doing more evaluations for hospice care, like determining whether or not a patient is appropriate, and a lot of critical thinking and a lot of digging through charts and putting pieces together. And I've already had the experience of calling our medical director to review a patient, and kept everything really simple and to the point, and thought that went really well. It's always nice to hear the words "good job" come from a doctor's mouth. And I recorded a voicemail report because we use voicemail here for everything instead of emails. And before I even got a chance to listen to my voicemails, I got a voicemail back from one of the supervisors telling me that I did a good job. So really, really great teamwork culture at this place, and pretty much in every way superior to the environment that I left. And I'm getting paid more now, which is great. And that's all looking up. I haven't had time to record any Let's Play videos yet. Maybe I'll have time to do that a little bit later. But I'm driving to the grocery store right now to pick up some sour cream because I got a text message request from my girlfriend Alexandra, who's waiting for me at home right now. So I'm kind of hurrying home to get dinner started and cuddle up for the night. I'm going to be getting up early tomorrow because tomorrow I'm shadowing a home health aide at one of the nursing facilities near me. After all the interviewing that I did, I interviewed for a sales position with a home care agency that was like clinical liaison, so they want nurses to do it, but it's kind of more of a sales job. That was one of the other big interviews that I had where I got to, multiple stages of the interview. And then my interviewing with this position that I just got, I was kind of surprised to feel like where I live was a factor in the application process, because I happen to live in an area where they don't have a lot of other staff members, which might be because of the distance from the office. But I got that impression in the clinical liaison job that I applied for too, that they were looking for people that had ties to my local area. So I didn't expect my geographical location to be a factor to work in my favor with applications and interviews, but it looks like it has. But something that I found out from interviewing both before and after I left my previous job is that it really is too hard to apply for jobs while working full-time in the kind of work that I'm doing, where you get phone calls a lot. And, it really was necessary to stop working full-time in order to really devote the attention and prepare for the interview process. I only interviewed at 2 places before I found this job. So I'm happy I didn't have to pound the pavement for too long while I was shuffling papers around and stuff like that. What else is going on? I'm in between classes right now. I just finished a class for grad school. It looks like you kind of have to take one class in all the different specialties. So I took a nursing ed class and a research class, And this class that I just finished was Comprehensive Health Assessment Methods, which was the one that I was most nervous about, because at the end of the class you have to record an hour-long, well, they wanted it to be more like 30 to 45 minutes, but I recorded 1 hour of video of doing like a full head-to-toe assessment at the APRN level. And you know, they expect you to do the assessment in a certain order, so it really like throws off my natural flow of like, you know, the steps that I think the assessment should be done in. But I ended up passing the class with a B+, and now that that class is out of the way, the rest of grad school is going to be a piece of cake. I'm no longer worried about anything else that's coming. I'm going to have to retake the family assessment class, or the assessment of families or whatever, because I dropped out of that class halfway through because of a personal crisis. So I'll just have to take that one over again, and it really is a nothing class. It won't be any trouble whatsoever. And then the only thing that's left is my clinical and my capstone. And I'm very excited about clinical because one of my favorite teachers from my community college program, where I got trained as a nurse initially, is going to be my preceptor. And her name's Rosemary, and she's going for her doctorate in nursing, and I'm going for a master's in nursing at the same school. And she went through the same, so we're going to the same school, and I'm going to be doing my clinicals at, I think it's a Yale Inpatient Psych, where she works full-time as a clinical nurse leader. So I'm pretty excited about that, and I'm going to start that sometime in the summer, I think, or the spring. I'm going to start doing that. Here we go. So that's what's going on for right now, and I'm just pulled up to the grocery store, so I'm going to leave it there. But I hope you're all having a good time, and I'll see you again soon, I'm sure.